Hi, everybody. This is Carol from the STS. This is the Adult Cardiac User Group call for September 16th, 2020. Today, we're going to give you some updates, and then we're doing our annual data manager polling, IQVIA updates, and then your feedback. Please include your ticket number and case number and your PID, your 5-digit PID, with any question you have related to support. On the line with me today, I have from IQVIA, we have Jeanette, Jean, Joe, Melanie, and Rhonda. From STS, we have Addie Dolan, Leanne Jones, and Melinda, who is our FAQ guru. So we're going to get started here with the STS updates. I'm going to kind of go fast through these so we can get through the polling and get over to the IQVIA questions. Hopefully the polling will be fun for folks and give us all a little bit of information. So the STS September training manual for adult cardiac has been posted to the website. Please check it out along with the FAQ cheat sheet. Harvest 1 report is going to begin beta testing. We do not have an official release date. As soon as we do, we will let sites know. Unfortunately, it's caused delay for all of us, and we certainly do apologize for the delay and inconvenience it has caused your site. We will get that out as soon as we possibly can. Harvest 3 2020 closed on September 4th. This data will not be publicly reported, and the surgeon leaders are reviewing the COVID positive patients and how that data will be managed for the any analysis that is done. The other item I wanted to talk about, we had an internal call today regarding the adult cardiac 3-year CABG composite. This will replace the 1-year composite for CABG. It's coming in 2021. We're aiming for Harvest 1, which will include data from 2018, 19, and 20. It will be on the participant level. Major difference with this model is that the confidence intervals increase from 98 to 95%. So wider confidence intervals allows for more inclusion. And then we will have an educational webinar in October. It will not be the monthly webinar. It will be another webinar that's scheduled probably in the evening time, so surgeons and other physicians are able to join, and we will be sending out more information regarding that. I'm going to start the data manager poll now, and this poll we do every year. We do it through a SurveyMonkey every year prior to AQO. It kind of gives us an idea of what's going on with sites and what different practices are going on, and it also allows us to get feedback from you on things that are going on at STS. So the first question is, which database do you abstract for? This is a multiple choice question, and feel free to go ahead and answer it. It's multiple choice, so if you're abstracting for more than one, please fill that in. Okay, well, it looks like we're pretty clear here. It looks like near everybody is abstracting. Well, everybody on this call is abstracting for adult cardiac, and then a few other folks are abstracting for general thoracic, congenital, and or intermax. Nobody's abstracting for PDmax. These results will be available on the website after probably within the next couple weeks. So we will definitely share those with you. The next one is tell me about your database. Oh, we did this. Tell me your database. That was the one. All right. Next question is we're going to do your background. So what is your background? Are you a nurse? Are you APN, perfusionist, non-medical? How long have you been abstracting for? Oh, let me launch it. What's your background? And then how long have you been abstracting for? And who do you work for? Hospital, data abstraction company, or both? So there's 3 questions in this poll. And as folks are answering the question, just a question came in from Michelle asking about the CABG composite, and can I explain it again? So we will have an educational webinar on this in October, and we'll send out more information to sites regarding it. Essentially, the 1-year composite's going away, and we're going to a 3-year composite with wider confidence intervals. But please join the webinar in October. It looks like most folks have voted, so I'm going to stop the poll there. Your background, most folks are RNs. Time abstracting, it looks pretty spread out, with most folks having over 10 years or more, which is really great. And then who do you work for? Most folks are working for hospitals, a few are data abstraction companies, and some are working for both. So I'm sorry if I'm going to share these. All right, the next one is going to be, tell me about your role in abstraction. So let me pull that poll up. These questions are, what is your role regarding data abstraction at your site? Are you the primary data contact and you abstract or do not abstract? Are you a backup data contact and abstract or do not abstract? Are you a physician representative? Or do you hold another role? Do you utilize a third-party abstraction company? How many cases per month do you abstract? And how much time on average do you spend abstracting, and when do you abstract? Real time, within 1 week of the OR date, 1 to 4 weeks, or greater than 4 weeks. And I can tell you, just from the end of this harvest and everything that had gone on, sites who are behind in abstract and who are abstract either that 2 weeks or more after the procedure is done, that really caused them a lot of catch up to play when people were furloughed. So I think if you're able to get to a more real-time abstraction, if you're able to put those resources into play to do that, or within 1 week of OR date, it's probably going, if anything like this were to ever happen again, definitely wouldn't be as far as behind. Okay, let's see. So okay, it looks like folks we're going to end this poll and share the results. So what's your favorite role regarding data, or what's your role regarding data abstraction? Most folks on the call are primary and they do abstract data, a few who are backup and a few who do not abstract data. Most folks, 77, do not utilize a third-party abstraction company. It's interesting that I think that number has gone quite up, almost 25% say yes that they do. Cases per month, we have between 30 and 40 cases per month seem to be the average, but it looks like a nice range between 10 and 50 cases, 10 and 100 cases a month. Pretty wide range for sites and size of sites here. 2 sites do over 200 plus cases. Most folks, it takes between 1 and 2 hours to abstract a case. Some are 2 to 3, and I'm sure that when we get into the complicated day order cases, we probably get up more in time. The timing of extraction, most people are with 1 to 4 weeks after OR date. If possible, I would definitely try to move that timing up to within 1 week of OR date. So should anything happen again in the future, when you get back to work from being furloughed, you don't have that huge amount of work waiting for you as we all try to get caught up. I really saw some sites struggling with that. The next poll is show me the numbers. So how many cases how many cases per year does your hospital perform? So this is a total, not the number of cases you're abstracting, but how many cases your hospital performs, how many people are abstract, and how many people at your site are abstracting. And then see, I can do a Q&A. Priya asked, well, why will Harvest 3 not be publicly reported due to COVID? Yeah, that was part of the reason we're not publicly reporting Harvest 3. The surgeon leadership felt that wouldn't be really fair. Not just COVID positive patients, but also the impact that COVID had on elective surgeries and patients having surgery being much sicker since they were waiting to come in for procedure. Okay, let's see. Heidi asked about the calculation for 4.2. When is that going to be released? So the vendors are being certified on that now, and most have been certified for that. You can find it. This affects reports that I use for monthly data analysis, and it would be helpful to know. So I would reach out to your vendor and check on the status of that, Heidi. Okay, we're going to end this poll and share the results. How How many cases per year? Most are at the 200 to 500 cases per year. Some are doing greater than 1,000. It's a very impressive high number. And how many abstractors? Most are, it looks like 1 to 4 people is the average at sites. So that's pretty interesting. A few sites have 6 or more people. My guess is that those are probably the bigger programs. Okay. And then we're going to go to your previous experience. So what was your previous experience, or what are you still doing before you got into the quality world? Were you clinical non-cardiac surgery, clinical cardiac surgery, non-clinical but within healthcare, or non-clinical and not in healthcare? And it's interesting, we have a really great group of people on with us, and the experience that all of the data managers have is really impressive. Years of nursing and experience in the hospital. Let's see. So Karen Hardy asked, will we still receive star rankings from the period ending 6/30/2020? Yes, star ratings will still be received. We just are not going to publicly report them. Okay, I think so. I think we're good here. I'm going to end this poll and share the results with you. Most clinical non-cardiac surgery, so cardiology, non-cardiology, other medicine, medical administration, and then quite a few clinical cardiac, CVOR, CVICU, perfusion, non-clinical but within healthcare, and non-clinical and not in healthcare. And care, I think that's interesting. So we're going to go down to your work responsibilities now. Let me launch that poll. What are your work responsibilities? Are you only abstracting for the STS database? You only do, are you abstracting for other cardiology databases like NCDR? Do you have other surgical databases, maybe the other vascular registry, STS and other clinical responsibilities? Are you still at bedside, doing some bedside nursing or in the OR? STS and other non-clinical responsibilities, are you working in are you health information management or any other responsibility like that, or perhaps other quality initiatives that you're working on, or you do not abstract? I reached out. Okay, we have a couple questions in here, but I think that those are going to have to wait for until we're done here and we get to the IQVIA portion. And then there's a question in here from Darlene about she's new to the STS and looking for resources on the STS metric definitions that can give us information on the star rating metrics. And I'm happy to work with you, Darlene. I'll reach out to you after the webinar and be happy to show you where that information is at. Will you please repeat the answer about the star report? So you will still receive a star rating for the Harvest 3 report, which is this harvest that just closed, but that will not be publicly reported. So your site will still receive your star rating. It just will not be publicly reported or refreshed on the public reporting webpage. Okay, we're going to end this poll and share the results. Most folks are doing STS and other cardiology databases, and a few STS only or STS other non-clinical responsibilities. All right, and now we're going to go into your educational background. Let me get to that poll. And I apologize if there's any spelling errors. Okay, first one. So do you participate in the STS mentorship program? You're aware but not participating, aware and participating as a mentor, participating as a mentee, or you have no clue about this program. Will you be attending AQO this year? Yes, you've signed up. Yes, I will be signing up, or no, I can't make it, or what in the world is AQO? Do you find the twice monthly webinars helpful? Yes, you find them helpful and the amount of webinars is perfect. No, or yes, but you would like more frequent calls. Yes, there's too many calls. No, they aren't very useful, or this is my first webinar, I just found out about them. Do you feel, this is quite a long poll, so take your time reading through these. Do you feel that you have knowledge to do your job correctly? Yes, I'm good. Yes, I'm still learning. No, I definitely need more training. We have quite a few people on here with 10 or more years experience, so hopefully people are feeling comfortable with their knowledge. Are you participating in a regional group? Yes. No, I'm aware but not participating. Or what are regional groups? Have you participated in AQO in the past? Yes, annually. Yes, frequently. Yes, a few times. Yes, once. No, I haven't attended. And what is AQO? Did you find the version upgrade walkthrough helpful for learning version 4.20? And we're asking this question because we want to know if it wasn't helpful, we'll probably reach out to you and find out what wasn't helpful about it, because we want to do this for the other databases that will be going through upgrades. And we want to make sure that folks are comfortable when that go live date occurs. Next question, are you familiar with the IQVIA? Uh-oh. This is supposed to be, are you familiar with the IQVIA resource library? For some reason, I don't know if that question showed up all the way, but it's halfway on my screen. So yes, I frequented on the IQVIA platform. Yes, I've only checked it out once or twice. No, I don't know anything about the resource library. Please tell me more. Next question. Do you review the notifications on the IQVIA platform? Yes, frequently, yes, but I'm having difficulty understanding it. Or no, I skip it. Next question, have you utilized the IQVIA resource documents on the website? Yes and no. So we have resource documents on the STS website. Have you utilized those? I'm gonna let this poll run. Let me see if there's any questions we can. Okay. Nancy says in the future it would be interesting to add HIM as a section for attendees' backgrounds. I've noticed that number of people with HIM credentials. Yes, there are a lot of health information management professionals who do abstract for the database. We include those in non-clinical roles, but I think that's great, and we can definitely break that out a little bit further in future, next year's surveys. Thanks, Nancy. Okay, we're gonna end this poll and share the results. All right, do you participate? Yes, but not participating. So only 6% of people are participating as a mentor, and only 5% are participating as a mentee. And it's really, and 25% are not aware of this program. So I think we can definitely do some more education on this. The mentor program is a great program to help each other out and to have have networking with other folks across the country to help with abstraction or help others, or where you can get to share your knowledge. It looks like 73% of people have already signed up. 5% will be signing up for AQO. 20% can't make it, and 6 people didn't know what AQO was. So we can do a little bit more education. AQO was our annual data managers meeting. There's a lot of educational educational talks that go on during there, and it's a really great place to learn more. It's like a supplement learning tool to these webinars and to the training manual. Looks like people are happy with the twice monthly webinars. There was a comment that somebody would like webinars where people can speak up. As you can imagine, having 340 people with open phone lines would be kind of chaotic. So we do it this way, and your questions almost all the questions get read. So that's how we're going to do these webinars. No open phone lines for 340 people. Are you participating in a regional group? Yes, I participate. No, I'm aware but not participating in what are regional groups. So we can do more education on those, and we will, because I think regional groups are really helpful for networking and to just be more involved with people who are under the same types of pressure you are on. So have you participated? Most people have not participated in AQO in the past, so I'm excited to see if this is a lot of people's first times going to AQO, how they enjoy it. Next year we'll be in Denver, hopefully live in person, so I look forward to that. On version upgrade, people found it was either somewhat or very helpful. 3 people didn't think it was helpful, and I'll probably be reaching out to you to see what we could have done better. And 9 people didn't know about these webinars. So we held these webinars. They were the last Thursday of the month from January through June, and we walked through the form. They are provided as recordings on the STS YouTube channel. Are you familiar with the IQVIA? This was the IQVIA resource library, and most people are familiar with it. 72 people didn't know about it, so I would check it out. It's on the left-hand navigation bar in your IQVIA platform, and there's a lot of good documents in there to help you with understanding the platform. And we can probably, IQVIA can probably go through that a little bit further and talk more about it later on. Do you review the notification tabs? Most folks do. A quarter of people skip it. So that's good information, and maybe there's some things that we can change on there to make it so everybody checks it out, because I think that that's important when we have changes. And then have you utilized the IQVIA resource documents? And it's split, yes or no. We have lots of education we can still continue on, so we'll do that. And then, oh, this should actually say 2020, so skip over the reporting. I'm going to launch this poll. This is kind of our year 2020 in progress, and what are things that have happened this year that we had a lot of changes. So what would be the most helpful area to educate on for STS and IQVIA transition? This is multiple choice. I'm good. I can get my data in and understand how to clean before harvest closes. I'm a little confused with changes, but I think I will get it. Uploader, data quality report, critical summary report, missing variable report, harvest summary report. Got lots of reports. Direct data entry, non-analyzed dashboard. So are there things there that we definitely need to educate on more that you're having difficulties with? Please rate the STS communication regarding the transition. You felt very poor, average, pretty good, or excellent. Again, this is STS's communication. So how have me and my team at STS, how have we interacted with you during this time? What are areas STS and IQVIA can improve upon? Communication, education on the IQVIA platform, technical support, education, the STS database version 4.20. And I'm going to open up, I don't know if the chat box is open yet, but I'm going to open up the chat box, and feel free to put in any other comments you think that we can improve upon there. And then what is your biggest improvement you felt happened in 2020 regarding the STS ACSD? Put your answers in the chat box. How often, and you have to answer these questions in order for, it to close out, for your answers to be accepted. So just check one of those. And then how often are you using the ACSD training manual? I review it prior to submitting any questions to the FAQ mailbox. I review it monthly and find my answers my questions. Find it answers my question. I review it monthly but still have questions. No, I don't even know what it is. What is the training manual you speak of? And I really hope whoever this one person is that doesn't know of the training manual, I hope that we can help you learn more about it. So great comments coming in the chat box here. Loving the education, not having to wait days to get my data quality report after submissions, direct data entry, and I have to agree that direct data entry is very helpful to sites, and it takes time off of data cleanup, probably days off of data cleanup. Elimination of some elements, less abstraction elements. Yeah, that was a lot of work, but we did it. All of the above. Timeliness can be improved upon. I'd like to know more what you mean on that, Shelley. Better communication, liked the increased education regarding new version. Having these webinars is great. Really need reports. Yes, we know, and we're really sorry that they're still delayed, and we'll get them out as soon as we can. Melinda did an awesome job with the training manual. Communication from the STS team. Resources from IQVIA and STS are good. The new DCF is so much better, so much streamlined. The addition of the webinars is the biggest improvement. These calls are really helpful. Needs faster turnaround for national reports and version change your vendor sign up. Yep, agree with the national reports and the version changes. We have to give our vendors some more time to do these programming so they're not under so much pressure. Too many different reports in IQVIA. I wish it were more concise, one report. Yeah, I hear what you're saying. I think we have to come up with a way to make it a little bit, come up with some education to make the flow make sense on how to use those IQVIA reports for data cleanup. More calls, more communication. So to pull reports, others don't have the access or know how to pull reports. So if you want to reach out to me, I'm happy to help you with that question. I think it might be access in the IQVIA platform that we can help with. Faster submission, increased communication, upload the harvest to IQVIA than the prior method. That's great feedback. Improved documentation on IQVIA worked, but very frustrated that report is so late. We are all very frustrated, and I'm sorry that it's late. Quick turnaround time. I think these feedback, you know, we get a lot of negative feedback, and I think these are really helpful. So thank you so much. I'm going to end the poll and share the results for that one. And I think that was our last one. I'm going to hand it over to Joe Brower. I just want to say thanks everybody for taking time to answer these questions. We'll get these results out so everybody can see them and share them with your C-suite. I know a lot of sites ask for these for determining FTEs at your site, so we'll definitely get these posted soon. And this feedback, I'm just scrolling through the comments to see. Oh yeah, I just posted it. So if you're looking for more information on direct data entry, reach out to me and I'll be happy to put you in contact with Jane. Okay, Joe, I'm going to hand it over to you.
Okay, great. Thanks, Carol.
Sorry for taking so much time. Thank you.
No problem. All right, let's get into some of the updates. We did a release last weekend on the 12th, so just going to take a moment to cover some of the items that were included on that release, starting with a couple fixes in regard to the uploader, STS 2759. We did have some users reporting that they were stuck on a loading screen for the uploader and weren't able to submit files. So that should now be resolved. If you do still experience this, after this weekend's update, let us know so that we can look into it, but those instances should now be fixed. STS 3763. Some sites have reported receiving a critical error stating that a record was duplicated in the file, and that should now be resolved as well. So again, if you still experience that after this weekend's update, let us know so that we can look into your specific situation. Next, an update on the MIPS consent form. That form language is updated to include clarification to help notify participants that only one consent form is required per surgeon. So if the surgeon participates at multiple participant IDs, they don't have to submit a separate consent form for each site. The data submission to CMS will include data from all PIDs that have surgeries associated with an enrolled surgeon at PI. Next, some updates in regard to the dashboard report, STS 2017. Some data was missing from the dashboard in regard to the last creatinine level. So we did identify the cause of that, and that should now be resolved. STS 2143. Liver dysfunction data was not displaying correctly in the dashboard, and so that should now be resolved as well. There was a discrepancy in the missing percentage count for the results of that item. STS 2826. Endovascular cases were showing as missing even when no aorta procedure was performed, and so that should be fixed. STS 2388. The dashboard report is checking for 2.9 variables for cases entered on the 2.81 data version. So we did correct some of that logic so that those checks would include the correct version. And so that should now come up properly for you. And then STS 3070, the dashboard display label for diabetes control was updated. There was a mismatch between Harvest Code 5 coming up as other and Harvest Code 6 coming up as other subcutaneous medication when it should have been the other way around. So that has been resolved as well. And then just a couple additional updates in regard to direct data entry. There were some improvements made to help fix some logic, or add some logic rather, that has to hide child variables based on the response entered for their parent fields. So that should be a little bit more streamlined now and a little bit easier to use. And then next slide, we can go over some of the items that are slated for the release next month, which is currently scheduled for October 10th. So for these, the uploader STS 3621, VDV Max is triggering a critical error message for version 4.20.2 records. What's happening is that the VDV Max and other fields that were updated to allow decimal values in version 4.2, those are triggering errors saying that the values submitted are invalid, even though we are now allowing decimal points. And so that fix is coming next month. STS 3266, the uploader is showing a red X mark, even though the records are showing us updated. So we haven't seen a lot of reports of this, but what is happening is it's just a display issue with the upload history. So they are successful uploads. Records are being successfully added to the database, and the DQR is showing accurate results. It's just that for some reason the upload history, just that section underneath where you submit your file, is showing that there's a red X and it failed even when it was successful. Like I said, it doesn't seem to be happening often, but we are looking to get that corrected in the October 10th update. Next, a couple items related to the dashboard report. STS 2994 and also a couple duplicates of that, STS 2219 and STS 2068. These all have to do with the IMA, the internal memory artery, used displaying incorrect case count. So records where IMA is set to no are not correctly showing up in the dashboard. So we're looking into getting that updated so that reflects correctly. And then STS 3581 and a duplicate of that, STS 3387. The discharge mortality graph is showing up as blank in the dashboard report, even though data is present. And then a couple items related to the missing variable report, STS 3419. For this one, looking at the logic, we're looking at the logic for the social security number as it relates to the parent variable of SSN known. And so we're also looking into some issues where it's not showing in the correct denominator and we're getting percentages over 100% for missing. That is one thing that we are looking at. And then the other in regard to the missing variable report has to do with the showing 100% missing for the COT other item for 2018 cases. So we did identify an issue where some data had not been migrated over correctly from DCRI. That, just to be clear, and there's the note below this in smaller font there for 3830, we are adding, all the missing data is being added in the back end for the harvest submission to DCRI. So you won't see that data updated and fixed on the missing variable report until this October 10th update, but do be advised that we are adding it for the harvest cut. And so the data we send to DCRI will include these missing elements, even though they will still show as missing on your missing variable report until October 10th. And so don't worry about the data not being added. We are adding it in the backend file we send to DCRI. And then finally, just to know, if you have submitted a ticket that isn't listed here, we are reviewing those tickets, and our support team will follow up with you on resolution and updates regarding the release date and when it has been resolved. You should hear from us. And if you ever want an update on anything you have submitted a ticket on, feel free to respond to that ticket and ask, and we can provide you with the latest information.
Wonderful. Thanks, Joe.
My pleasure.
We're going to hand it over now to Rhonda Murphy for an update on the risk-adjusted dashboard report that we're also eagerly awaiting. Rhonda?
Hello.
Hi.
Okay, yes. So in a minute here, I'm going to log in and give an interactive demo of the report within the application. Just quickly touching on a few points listed here in this slide. There's a lot of benefits moving from that paper report that was a couple hundred pages of different reports and information about the reports, and we're now moving that into the application and making it an interactive report where you can navigate to the different reports that you used to see within the paper report, and the added ability to drill down to the patient level within different sections of the report. So we're super excited to show you that. We also have the option of reporting, of being able to print the report to a PDF with a one-click button. And again, you would have that paper report available to you so that you can send that off, share that with other stakeholders. And the report interpretation and overview, that information about the report that you would get in that front sections of the paper report, that information will be within the library, within the platform, so you can still easily access that information and be able to have that available to you as you review the report. The next slide, please. Thank you. So this is the landing page. Once we get into the report and we generate it for the harvest period that we're looking at, this would be the landing page. And each of these sections and the reports within the section, those all represent the different buttons that take you to those specific reports. In the top corner, you see the export report button, and that's the one-click button that you can quickly snap this off into a PDF to share later. Next slide, please. Thank you. So just some quick screenshots about what we're about to see. The top report there is the tabular information that you're used to seeing, and then the bottom report is a new graphical display that shows you how you performed relative to STS and where you fell within that confidence interval, or if you fell within those min and max ranges. Next slide, please. And then in these detailed reports, you have the ability to click on one of the rows and drill down to that patient information and have everything available to you right there within the application. I think that was the last slide, and I'm ready to share the screen.
Okay,
Thank you.
take it away.
Okay. So I know we're getting close here on time. So is the screen up now? Hello?
Yeah,
Oh.
yes, I can.
Okay.
Yeah, sorry.
Okay, sorry. So once you log into the application, you land here on the notifications page. And again, if there's any notifications, they would be posted here and available to you. So I navigate here to the operational reports, and there's now this new ACSD risk adjusted dashboard report.
Not yet, though. Most sites don't have this available yet.
Okay, not yet.
Right. This is on the IQVIA background. This is your access, not the site access, just so they're not logging and looking for it.
Okay, yep. This is what you would see once this report becomes available to you. We would have this extra ACSD risk adjusted dashboard option. And then there is a link here that would take you to the report and a brief summary about what you will see within the report. So once I click on the report, I see the reporting period parameter. Using the drop-down, I would select that harvest period that I'm interested in reviewing and then apply the parameters, and that will pull together the report and take us to that landing page that we just saw. Once the report loads, in the top corner, you'll see there's a little spinner that keeps going, still loading information in the background. And once that completes, you'll see that the export button is there. So if you first log in and you don't see that right away, check to see if the spinner is still going and that we'll let you know. So once the report loads, you have this landing page. And again, each section here with all of the different reports, and these are buttons that take us to those reports. So an example of the composite quality rating report here, the top section shows that tabular information, your star ratings by domain, and then going down here, I can see that graphical representation of how I did and where I fell relative to that confidence interval and those min and max ranges. This is, everything looks a little close together. So what we have is this slider bar so that you can kind of zoom in on that and give yourself that more expanded view so you can really gauge and see where you fell, and you can hone in more on your performance. At the top of the screen, there is this icon here that takes us home. So clicking on that would take us back to this home page, showing you an example of one of those drill down reports. This composite quality rating report here, each of these sections, I am able to click on this and drill down to that patient detailed. We do not have that loaded here in this test facility and would not show that in a demo, but what would happen if I clicked this button is I would see that detailed down below here. Clicking on the home button again takes me back home. This rating trends graph, this is the star ratings report that we can view, and as more harvests come in, we would see each harvest appear within this graph here. The process and outcome measures are set up similar to how we just saw, where you have your tabular information up top and then your graphs down below, and the same slider bar functionality. Within the process measures, you do have the ability to click on a row domain and drill down to see the details of that row. So by clicking the See Details button, that would have presented here that case list that I would have the ability to view. Again, taking me back home, and then looking at one of these risk-adjusted variable reports. Here is that tabular information by category, variable, and measure. And again, taking that paper report and making it more interactive so that you can come in and quickly view your information. Prior to us viewing the report, I did already click this export report button so that we already can look at that. And so by clicking that button, this report, this is the PDF report that we now have. And as you see here, it prints out by page the different reports that we are able to view within the application, clicking around from that home page. Okay, so that gets us through the risk-adjusted report. Melanie, can you think of anything that I may have missed bringing up or highlighting?
You covered everything in regards to going through the different sections and presenting where you're able to do the drill downs. As Carol had indicated earlier, we are going through the beta process and we'll be gathering more feedback from that group. And then also targeting to make it available to all users. So we're working on getting that done as soon as possible. That's it. Thank you, Rhonda.
Thanks. Thanks, everyone.
Thanks,
Awesome.
Rhonda. And Melanie and Joe, as always. I guess I can share my screen again. And just so you all know, the IQVIA toll-free numbers are still down, so we have to use, and they're going to be down for quite some time, I'm told. So we have to, if you're calling in, please use the toll number. Hopefully that's able to get you in.
I think that's the Zoom numbers, Carol, not the IQVIA numbers. Is that correct?
I shouldn't have been on that page. Yes, that's right. The Zoom numbers, when you're calling in for the webinars, please use the toll numbers, not the toll-free numbers, because Zoom's toll-free account is down right now. So just the toll numbers. Okay, now on to the next IQVIA support plan. Same plan, reach out to IQVIA. If you know it's a vendor issue or something in your vendor software, please reach out to them. If you have a difficult time, either one will work and we'll get you to the right spot. Again, like Joe said, if you're waiting for an update on a certain ticket number, please respond to that ticket number, the email with the ticket number in there, and they can check into it for you. And also in any correspondence with IQVIA and STS, please include your participant ID number or your PID number, which is a 5-digit number. For adult cardiac, that number will start with a 1 or a 3. In your resources, please submit your questions. We have some time, we can get through a couple of them. And then our next monthly webinar is October 7th. Also, what's not on this slide is the 3rd week of October, around the 20th, we will have a webinar. We haven't decided on a exact date yet, but we're planning the webinar for the 3-year CABG composite model. It will be in the evening, and we will be sending out notifications to sites and to surgeons. So who's ever available to join will join. Okay, so let's go over to some questions. This first one is for IQVIA. I've reached out to tech and they were not able to help. I submitted July cases and received 93% error for, and I'm not sure what this is, QAC 1103. This is a child field that is not opened unless mortality occurred through Lumetics.
Yeah, this is one our support team was taking a look at since you posted the question. So thank you for reaching out. One of the IQVIA team members is going to be reaching out to you for more information. It is possible that there's a disconnect within your vendor system, but we'd just like to double check that and make sure that it's not something showing up misaligned within the missing variable report. So we'll need to dig into that a little bit more with you just to make sure that we're clear on the disconnect there. So we will have our team follow up with you.
Great, thank you. Thanks, Jeanette. I've been told that they did not have enough mentors. That's correct. We don't have enough mentors for adult cardiac. We're really far behind. If you have 2 or more years of experience and you would like to take on a mentee, it does not take much time. We've been hearing from other mentors that minimal time, just a couple questions, great person to just be able to reach out if you have something going on. We have our mentorship information underneath the education page of the STS database webpage. And I'll be happy to show you that here. I didn't want to take up too much time, but I think that this is important enough. So hold on, let me
and I'll put the link in the chat box also, Carol.
Okay, thanks. So the STS homepage, and then we go to registries, STS National Database. You scroll down on this page. Do not click on adult cardiac, just scroll down. And then underneath here, make sure we don't have a separate link for it. This is where you'll find regional group information, AQO information. The data manager survey from last year is under education. And I think this is where the mentor-mentee program is. Yep, there it is. Yep. So under data manager education and then the data manager mentorship program. If you have more than 2 years experience, it would be great if you could sign up and we'll send you 1 or 2 people to reach out to that would really appreciate just having that extra support from somebody who's been in their, whose shoes now they're going to try to step into. So it would be great if you could fill this form out and help us out. And then Donna says, I'm glad to take on more mentees, send them my way. And Donna, I'll let Addie Dolan is now over this program. So if you want to reach out to Addie Dolan, Leanne will put her email. It's adolan@STS, and she'll be able to send folks your way. Thanks for offering that. Question for IQVIA. We are a site new to direct data entry. The only hard stop is the birth date. I was able to mark a case complete even though the entire post-op complication site was unanswered. Is this how it should function? Am I correct that it does not function like NISQIP where incomplete tasks show as warnings and one is unable to complete the case unless warnings are addressed?
Hi, Lauren. This is Jeanette. So this program is a bit different than the other one that you mentioned. So in the STS programs, there is more emphasis on the review and the missing variable report. But we've definitely gotten some feedback from the direct data entry user community about wanting to see more validations directly within the form as you're entering or abstracting the data. So we are working with STS and discussing some options related to that. We also get a lot of feedback from the submission process. Users feel that there are a lot of messages in there. And so we want to balance both of those two perspectives with regards to the feedback in the system. So we do encourage you to review the missing variable report regarding the variables that would need to be filled out, and are looking at some options for showing more of those validations in line the way you would see in the NISQIP program.
Great, Jeanette. Thank you so much. Next question, maybe explaining abbreviations like AQO would be helpful. Yeah, and I thought about that when I said it, and I should have listened to my instinct to explain what AQO was. So AQO is Advances in Quality and Outcomes. It's a data manager's meeting, an annual data manager's meeting. And advances in quality and outcomes, talking about ways that we improve quality through the database, maybe at the sites or at a regional, national level, and then how we are improving outcomes for patients. And when you click on that link, there more information will pull up here. We have our agenda for the upcoming meeting listed here. Something's happening on every day. Adult cardiac is on Thursday, October 1st. The link to register is here. Unfortunately, the early bird registration has now closed, but I still think it's a good price if you're able to join. The pricing is $200 for non-members for one day, $400 for all days, or $150 for members for one day, or $300. Members are folks that have signed up to be an STS member. It's different than participating in the database. It's another type of membership, and if you're interested in that, you can contact member services here. The agenda for Thursday, which is our day, adult cardiac, we have some pre-recorded sessions that will be available, I believe, a week ahead of time, and then we have the sessions that are being offered on this day. So the live sessions are hemodynamics and echo with Dr. Whitman and Melinda. And they're also doing a very interesting case about a TAVR gone bad patient. That's really interesting. Aortic valve, aortic root, and arch from Dr. Kim, Dr. Desai, leaders in the aorta field, and Nancy Honeycutt, one of our core members. Incidence and spacing. How do you code something how do you capture something when the first procedure may have been a coronary, and then the second procedure now is maybe a descending thoracic aorta, and how do you capture incidence and spacings accurately on those cases? They can get tricky when you get into the ascending and root area. Mitral valve with Dr. Badwar and Cindy Piotr and Patty Toyer. They'll talk about Carpentier classification and other important anatomical areas regarding mitral valve, AFib, Mays. Ann Greco is doing an interesting case with a lot of interesting questions about transplant patients and assist devices, and then what data managers panel want to know. And then we have a trivia challenge, which is kind of a fun networking thing Thursday evening. We also have some, I don't see it on here for the morning time, but some of the mornings we have things like yoga, coffee, yoga, greet and meet. We have a mindful breathing exercise, mindful breathing or mindfulness type of workshop.
Carol?
Leanne?
Carol, are you
Carol,
there?
may
I
have
think we
gotten
lost.
disconnected.
Yep, I said we lost Carol's audio. Oh, yep, looks like she got disconnected. All right, I'm sorry, everyone. Hold on just one moment. Let me try and get into. Let me see. All right, lost Carol.
It kicked me off. Are you
Oh,
there?
are you there, Carol?
I'm
Yes,
here.
we have you back.
Did it kick everybody off? I was going through my
And
whole
now,
spiel.
I know everyone's still on. All the attendees are still on, but your screen's not sharing any longer. But there you go. You're coming back up.
Oh, I'm so
And
sorry.
there we
everybody.
go. That's okay. I was texting you. I was trying to say, I was like, oh, we were all like, she's probably talking away, but you're back.
I was
but
talking away. Sorry about that. So if you're interested in AQO, Advances in Quality and Outcomes, and I lost all the questions because it disconnected me. So Leanne, if you have,
Okay.
you can read the next one, that would be great.
Yes, ma'am. I absolutely do. So our next question, it says, I'm sorry I missed the beginning. When will the 2019 year-end report be released? I see it's still in beta testing. Any idea when it will be released?
Yeah, hopefully soon. We don't have a date yet, but as soon as we do, we'll let sites know. It is in beta testing, and and we apologize. I know it's been very inconvenient for sites. So as soon as we do, we'll get that information out.
Okay.
And I can
All
stay
right, perfect.
I can still stay on if anybody else is able to. That's great. I feel bad that I got disconnected. And,
Yep, sure. I can stay on as well, and I'm happy to read the questions.
Okay.
So our next question that we have, does the STS assist in setting up and maintaining regional groups? It appears that my region's user group has fallen apart.
Yeah, we can definitely help with that. And if you would like to reach out, Emily Conrad at STS kind of is over that, but you're welcome to email me at ccrone@sts.org, and I can put you in contact with Emily.
Correct. Perfect. And Heidi had a comment too that she she manages the Iowa regional group, and she's included her email there if anyone wanted to contact Heidi regarding the Iowa regional group. So that is available. All right. Thank you, Heidi. Our next question or comment to the cost of AQO has been an issue for our facility and data managers being able to attend. That was just one of our comments. If you wanted to, hopefully you were able to take advantage of the early bird pricing this year. And as Carol stated earlier, our current prices are still reduced, and I hope that you all have been able to take advantage of those. Our next comment says, hospitals are cutting back on educational reimbursement due to loss of revenue. We still have a virtual option for AQO next year. My hospital will not approve travel expenses to out-of-state conferences. I'm sure the financial impact to hospitals will last a long time.
Yeah, I think right now we're still planning to do AQO Live. I'm not sure about a virtual meeting. I think it's all something that we need to think about and see what the landscape is in a few months just to make that decision. So we can all have proper planning. Yeah, we definitely hear what you're saying, and a lot of people, including hospitals and just folks in general are struggling with finances right now. So, yeah, we have to make a good decision.
Yep. Our next question from Cheryl says, I would love further education on aortic procedures, AF procedures from STS.
Yeah, we can definitely
That was
help with that. If there's something specific you'd like us to help with, please email me. I'll put my email in the chat box so you can see it. Please email me with your ideas. I have a list that will be able, oh, I almost put my personal email in there.
Don't do that.
Too, but I don't want it to get lost. So there you go. Email me with ideas. I have a list of things that people send me for upcoming webinars, and we just haven't been able to get to a whole lot of them because of the education on the IQVIA transition. But hopefully in the next few months we can.
Right. Our next question is, says, can you show us how to create tables? This will help us doing data checks. I don't know
I'm not sure
if
what
that
that
was.
means, but
Yeah, I'm not sure. If you could elaborate, that would be great. Let's see. Someone had asked about data entry and direct data entry and how many participants we have currently taking advantage of the direct data entry. I don't know those numbers off the top of my head, to be honest.
yeah, I'm not quite sure on that.
Yeah, I'm not sure.
I think we don't have those numbers, but our side does.
Our next question, with the national benchmark data, will there be a resource guide report overview available that explains the data, the STS models, and the risk adjustment supplement? So basically our report overview documentation that used to be in the front of the their past quarterly reports, PDF reports.
Yep, it'll be available. Donna's cleaning it up now, so it will be available. Hopefully a little bit better than what it was.
Yeah. Our next, there was just a comment for thankful for the decrease in data elements for the new upgrades. Our next comment from Deborah, she says, having like a document with the steps to do cleanup using the IQVIA reports prior to harvest would be nice. And I know we are working on that for other databases, and I think it's definitely a great resource documentation that will be available for our data managers.
And Leanne, we do have, remember, we provided a checklist, I believe, in our last session, if I remember correct, in the last webinar, in the presentation. I thought that there were steps, or maybe am I incorrect? Because if so, that last session that we had, last user group in the beginning of September, I think we have the steps listed there.
Okay.
I'll look. Beginning of September?
Yep.
I believe it was our first session in September, where we had checklist steps in that presentation.
Okay. I'll check it out, and
if not, we'll get something up, but I thought we started to share that.
Yeah, we can also go through it again.
Let's see, our next comment, great education from STS and IQVIA. I would still like more education from IQVIA as I'm new to STS. I want to make sure I can use all of the available reports and clean up my data the best that I can. So would you please review the STS ACSD communication circulations and how we can opt in to receive them?
Sure. So the STS communications for the databases get sent to all primary, backup contacts, along with surgeons at your facility. I believe all surgeons. If not, then the lead surgeon that's listed on your contract for your facility. Some sites, for whatever reason, they're either getting blocked at your site, they're getting put into the spam folder. Whatever it may be. If you're not receiving our communications, we have an option to add on a secondary email, so usually a personal email to your account, and we would also send communications to that email. Managing email, making sure that it's getting where it needs to go, is like a full-time job plus in itself. So I'll put the email in the chat box where you can reach out and send in your secondary email address. Include your PID, which is your 5-digit PID number, starts with a 1 or a 3 for adult cardiac, and what email you would like added.
All right. Our next comment from Teresa. She finds the IQVIA difficult to navigate. There are lots of errors. And I'm sure if you have difficulties navigating the IQVIA website, if you are at contact tech support, someone from the IQVIA end would be happy to help you navigate and give you tips and tricks. Because I know in the past, Melanie's team has provided some tips and tricks for navigating within the platform that has been very helpful. So I don't know if Carol, I'm sitting there answering your question, so I apologize.
Oh, no, you're fine, Leanne.
Anne wants to know if the answers to the survey will be posted somewhere.
Yes, we'll post them. It might take a couple weeks because they come across in a big Excel spreadsheet. We have to separate them out and then make graphs with them. But yes, we will post them.
Yep. This question comes from Liz. Elizabeth, she says, the people that answered that an average case can take 1.5 to 2 hours, are you manually abstracting the case from start to finish, or are sections filled out by other people and you are validating the information entered? Are your surgeons using the surgeon worksheets? Are there elements that are electronically populating into your data abstraction form in your vendor software like labs, etc.?
Can you put that question through as answered, and then maybe folks can put in their comments in the chat box?
Mm-hmm.
Okay, thanks. I think
Yep.
that's
There we go.
Thank you.
Yep, that is a great question. Mm-hmm. This is a question for IQVIA. If we are doing direct data entry with IQVIA and we mark a case complete, do we have to do anything for a risk score, or is it automatically calculated in the system when it's complete? Or is there a way to view this?
This is Jeanette. That's a great question. Thanks for raising this. So the risk scores will be automatically calculated, and those will be visible in a report that we will be making available in an upcoming release. So we do apologize that's not visible to you right now, but that will not affect your harvest analysis because DCRI does do sort of their own recalculation of those scores. So the verification of this score would be for your information in advance of the harvest, but it won't have any negative impact on your harvest submission. So we do look forward to making that available to you as soon as we can.
All right. My next comment from Nancy, she's not keen on the many different reports within IQVIA. They have a lot of overlap, and we've heard this comment again from several of our data managers. It'd be nice to combine some of them and have surgery dates listed, and I do know that we've had that feedback and taking that back into consideration. I don't know if IQVIA had anything to add to that.
And I think I mentioned this in one of the other meetings, but so we are making an adjustment in an upcoming release to make the list of reports a little bit clearer to navigate with more obvious descriptors of what each one is for. So we're definitely looking at that near term, and then longer term, we certainly are evaluating the best way to navigate all of this information and providing those checklists and that sort of thing. So we definitely welcome your feedback and do appreciate it. And we'll be making adjustments to the system as we can.
Great, thanks, Jeanette. Our next question from Gail, she puts the information in IQVIA. She has 2 abstractors. How can they view information in IQVIA?
Both of those abstractors need to be on the IQVIA platform as either backup or primary data contacts. And I think if they're having difficulty with access or they feel that they don't have the right access, then they need to contact Jane. And I'll put the email in there, STSDB@sts.org.
And also just in response to Elizabeth's question, people are putting responses into the chat box. So just wanted to let her know if she wanted to scroll through there and get some comments, some feedback there. I'm happy to read those as well. Our next suggestion from Heidi, is it possible for STS to develop quizzes for us to assess how we are abstracting? They could be posted on the website, monthly case studies with answers provided after the fact. If people wish to do them, great. I think it would help us improve accuracy. If people don't wish to do them, it wouldn't be mandatory, but it might be helpful with areas of concern that are mostly discussed at AQO yearly after audits.
I think that's great. We try to do things on the webinars when we're doing clinical things to ask questions and test people's responses. It's an idea, and we can definitely take it back and talk about it.
All right, our next question, can we get these ongoing issues set up as a living document on the IQVIA site instead of reporting like this?
Hi, this is Melanie. So we do post this information within the notification section. Some items that are being reported, if it's an item that is related to a specific site, and if it has potential impact for other sites, we report it out. And again, that information is shared within the notification section. But if this is, I think the recommendation is just to have a ongoing running tally of these issues. We could potentially look into that, but right now you do have the ability to review this same information that you're getting in the session on notifications.
Okay, and also just another comment or a question about the notification section. Why are they remaining red, as in not having been read when they have been read? So I don't know what's.
So the red
question mark.
dot will remain if you haven't read all the notifications. So reading them would involve just expanding them so that you can see more than just the title. And then I believe there's a color change. So the red or not read notifications, some will be white and some will be gray. I forget which one is which, but once it registers you as having read it, it'll change the color for you. And then when the system sees that you've read all of them, it'll take your red dot off your left navigation. Hopefully that answers your question. So it's thinking that you haven't read at least one of them, and that's why the dot is still there.
Let's see here. All right, our next question. I apologize if this has been previously covered. With the version 4.2 update, does the ankle brachial index result of less than or equal to 0.9 no longer count towards positive results for PAD?
Sure, I can take that one. And Melinda can fill in too. The idea behind removing that from the training manual, I believe it's removed completely from the training manual, is that data managers shouldn't be the ones making a diagnosis of PVD. So that certainly probably is an indicator of PVD, but that documentation has to come from a physician or physician representative. Melinda, are you there, and do you have anything to add to that?
No, I think you did a wonderful job explaining that. Thank you.
Thanks.
All right, our next question. There have been issues with duplicate record ID not resolved between IQVIA and vendor until after harvest was done. Will there be ability to submit one more correction? How will having duplicate record IDs affect risk adjustment and accuracy? Won't the case still be inaccurate with these critical errors?
Can you say
Hi,
that
this is
again?
Melanie. I'll take this one. I'll take this one. So the issue with the duplicate record ID, I believe Joe did cover that as an item that was resolved in the September release. But there are specific instances where, and again, not all sites are encountering this. We do have an issue where there were specific duplicate record IDs that were being shared between two different patients in some uploaded files. Again, it was impacted. It was, I think, one vendor that recognized that it was an issue and they were working on that. But in the instance when there is an actual duplicate record ID that is being shared by two different patients, the data warehouse is not going to accept that those records, and you will encounter that. So that is something that the vendor, if they haven't resolved it as yet, they would have to get that resolved in order for that information to save. But in regards to, we did have other reports where there weren't any duplicate record IDs. We did see that also occur for certain sites with certain files, and that has been resolved as of the September 12th release. So if you're encountering that still, please reach out to us so we can validate and take a look at the file. But if you have not tried again, go ahead and retry uploading your file.
Okay, thanks, Mel. Our next question for IQVIA, I was wondering if IQVIA is still considering an enhancement to create logic between PID number and hospital name. This will help for sites that submit for more than one hospital to ensure their PIDs and hospital names match.
This is Jeanette, and I don't know that the IQVIA team can stay on too much longer, but I'll take this one.
Yep.
So yes, we are absolutely still looking into some options to streamline that. I don't know whether STS would like to start validating against that name and start kicking your records out if your name doesn't match. So we will talk to them about that suggestion, but that is definitely an area that is of interest, and we'll be looking more into that.
Thanks, Jeanette.
Thank you, Jeanette. All right, just to give you a heads up, just to give a question count, we have about 25 questions remaining. I know we're at, about 4:18. So Carol, you just let me know.
Yeah, I'm
When
sorry
you
that
want to.
I'm sorry that we continually run over, but I think it's important to get questions answered. And if folks still want to stay on, I can stay on until the 1/2 hour, and then I have to go. So maybe we can do 12 more minutes of questions. And if IQVIA needs to hop off, please feel free to do so. We can save your questions and send them to you and see if there's anything with ticket numbers that need to be followed up on. We'll pass it along. And but I'm happy to stay on, Leanne, if you are, and read the questions for another 12 minutes.
Sure, not a problem.
And these are recorded, so if anybody needs to hop off, the question part is recorded, so we will be posting it. And eventually, we will get to a time where these calls will be strictly Q&A, and we won't be doing too much more than that on these calls, so they shouldn't run over in the future, or near future. But I think we should go through the rest of what we can.
Sure, absolutely. All right, our next question, for mechanical cardiac assist devices, why are we only supposed to be capturing planned and consented devices now?
No, that's not what the field says. Let me pull it up here. So that was just for the 5.0 liter, 5.0 liter Impellas. And I'll show you this. Hold on. Can you see my screen?
Yes, ma'am.
Okay. So I'll go to the annotated data collection form. I'm going to scroll down here to, I believe it's section L, which is the VAD section, mechanical assist device section. Getting closer, here we go. So the first question, this is one of our temporary fields. It says planned and consented insertion of a device that can deliver a minimum of 5.0 liters of flow using an open surgical approach, either transaxillary or transaortic during an index cardiac procedure. This field is a field all by itself. It's not apparent to anything. So it's just asking a question, yes or no. We're looking at these closer. This is usually Impella 5.0 or a greater. We're looking at these closer because these are often used more for the thought of a long-term care, but the Impellas are actually being collected as temporary assist devices. So we just want to collect if what you're putting in this temporary assist device field is a 5.0 or greater. And we're going to do separate analysis on those and see any difference in outcomes between these devices and devices that are less than 5.5 liter flow in the future. So these are not the only devices that you're supposed to be putting in. You're still supposed to be putting in all your balloon pumps, your ECMOs, and any other temporary assist devices, in addition to VADs that are done in conjunction with an analyzed procedure. Melinda, do you have anything to add to that?
No, I think that I was actually on the California call this morning, and I talked about that temporary code. I'm wondering if that was where Alicia was picking that up from.
Okay. Yeah. I think sometimes we get people who try to help educate, and they may understand things a little bit differently than what STS intended it. So it's good to ask questions if it seems funny to you. So thanks for asking, and happy to clarify it. Thanks, Melinda.
Perfect. All right, our next question, will surgeons have access to the risk-adjusted dashboard?
Yes, and they did receive access. IQVIA access was sent to all of our surgeons. If they have not received their access or didn't attempt to log in, then their access probably was shut off, or the password and all that temporary stuff has gone away now. They will need to reach out to STSDB@sts.org for access to the IQVIA platform, and I will put it in the chat box. And Jane will resend their credentials.
Mm-hmm. Okay. Our next question from Rhonda, how will star rankings be displayed?
How will star rankings be displayed? Just the way that,
Mm-hmm.
way that Rhonda showed it on the screen. It'll be on that risk-adjusted dashboard.
Mm-hmm. Our next question says, IQVIA isn't showing the majority of the reports that we utilize besides star rankings and metrics. For example, percent extubated, less than 6 hours, blood product analysis, vent hours, ICU hours, age, gender, all of the various other complications. The star report is just one small piece of the outcomes report that facilities utilize to monitor their facility quality of care.
Yeah.
And
this would be our benchmark.
Go ahead, Carol.
This will be our benchmark report, and I don't know, maybe Melanie can talk more on that. I think it's a future report.
It is a future report. So the report that they would receive that we're targeting for this month would not have that additional information, but we are working on getting that added.
And this would also include the anesthesia data. Is that correct, Melanie?
That is correct.
Additional report. Okay, great. Thank you.
My next question, when will star ratings for December 31, December 2019, and this will be cabbage for 3 years on that report or on the next one through June 30th.
Can you say it again, Leanne?
It says, when will star ratings through December 2019 be available?
Oh.
And will this be cabbage for 3 years on that report or on the next one through June 30th?
Yep, cabbage for 3 years will not be reported until 2021. And this report, the H1 2020, which contains data through December 31st of 2019. So that's Harvest 1 2020, contains data through December 31st, 2019. That will be available soon, and we will communicate out to sites when we have more information. It is in beta testing now.
Okay. Looks like great improvements. Thank you. Just a comment, the landing page seems small compared to the page. It may just, maybe the print could be bigger or more information can be seen at one time. Again, lots of scrolling, just a comment on what was being viewed on the screen. It says, this may be a dumb question, but in the ACSD dashboard report, the blue bars seem to be the wrong way to read. Is that just me? I know we don't have that up anymore, but.
What part, which the bar graph for the star rating report?
Yeah.
Is the wrong way to read. We did it, it's reversed. That's how I guess that's how it's supposed to be written. It looked different to me too, and took a second to understand that the values were to the left instead of being to the right. So it's a little different, but it was a thoughtful decision to do it that way. It's just something we're going to have to get used to.
Yep. And then Sue Ellen wanted to know if there was a search function on the report that Rhonda was presenting. So I don't know if our IQVIA team can answer that.
I'm sorry. I was trying to find the mute button. No,
That's okay.
it's not searchable like within a Word document. But you can Control F on screen when you're within a report to find something. But once you have and then you can search, I think, the PDF once you have the PDF printed out.
And then thanks, Rhonda. And then someone just was asking about the like group. Wanted to know where the like group comparison was.
I believe that. Go ahead.
Oh, I'm sorry. The like group comparisons, we had those on the in the risk adjusted variable section. Within each one of those reports, there's the like group comparison and then the 3-year trend. Does that answer the question?
Yeah, I think so. It's on there, and I saw it on there. It's on the report, and along with the STS group, the
Right.
STS average. Mhm.
And then here's a question for the composite. Will the 3-year composite be for mortality only, or will it include other post-op information as well?
No, it's a 3-year composite, includes mortality and morbidity, which makes it a composite model. So it'll be the composite with mortality and morbidity endpoints, and then the NQF measures I believe, will stay as is for right now with the 1 year. More information will come again. I'm not really involved in the building of the model. I just know enough to be dangerous and give you bad information. So we have to wait for the educational webinar for that.
Great. Our next question, will the STAR reports have a section which explains the process like the old DCRI reports did? Will they have a section that gives the numbers, percent of 1, 2, 3 STAR programs, et cetera?
I believe so. Yeah, we'll still have the report overview section, and I believe we'll have some of the other information. I'm not sure exactly that graph with the stars and how many stars were provided for each site for each procedure. I'm not sure on that. On that, I guess we'll have to talk to IQVIA and Donna about that.
Yep. My next question for Michelle. I'm new to the registry. If a patient does not have a pre-op echo, do I leave the valve findings blank? Example, aortic valve regurgitation, stenosis, etc. This puts a lot on my missing variable reports.
So
if a patient does not have a pre-op echo, do I leave the valve findings blank?
No, you can get this information from the cath report. I believe some of it should be from the cath report as well. Melinda, what do you think?
Well, I think I'm going to address this at AQO, but I know the answer. So if you don't have any documentation of aortic valve regurgitation or stenosis, if actually for any of the valves in your chart, then the correct answer would be to code no to aortic valve regurgitation. You say no. Aortic valve stenosis, you say no. Don't go to the parent field and hit yes just to get down to the child field that says not documented. Don't do that. So again, if you have no documentation at all,
that's a great
or regurgitation.
Yeah, that's a great point, Melinda, because I didn't even think about that. So we have not documented over here. And I didn't even think that sites would be doing that.
Oh, they are.
It's not documented. I didn't even think about that. So, and that's okay. Aortic valve regurgitation, you don't have that listed anywhere that the patient has it, then code it as no.
Yes.
Okay. Our next question, comment, it will be nice to have a save and next button on the bottom of each page so that we can keep the widescreen view. If I have the task panel showing the data entry points on the smaller screen, it's awkward, causing me to miss some data entry points. As it is now, I close the task panel and then open it back up when I am ready to go to the next section. It sounds like understood. It's 4:30, Carol. I just turned 4:31. I don't know if you have another meeting. We've got 8 questions left.
Oh, just go through them. Let's go through them.
Okay. Are nursing CEUs offered for AQO?
Yes. I don't know that we know the amount yet, but yes, they are offered through Core Excel.
Yep. It says, yep. And then do I recall that CE credits will be offered for attendance?
Say it again.
For AQO, do I correctly recall that CE credits will be offered for attendance?
Yes. Mm-hmm.
Okay. All right. Sequence 1711. Is it a requirement to document classifications to support the data and for auditors?
I think I know
1711.
Yeah, I think I know what he's talking about, Carol.
Oh, okay.
Yeah. They're talking about the Carpentier classification, and I tell you what, it's helpful if you can get your physicians to document that, but not all physicians do that. So what you have to be careful about is some of these selections, like endocarditis, for example, is in class 1 and it's also in class 2. So if that's the reason, then you're going to have to clarify with the physician, is it class 1 normal leaflet mobility or increased leaflet mobility?
Yep, and that's right, Melinda. That's good to point out. And the difference here is the leaflet mobility. So
Right.
if you have endocarditis and it is not affecting the leaflets, then you can say that that's normal leaflet mobility. But
Correct.
and if you have, and you can code that as endocarditis, native valve, and class 1. If they document endocarditis and the patient has flail, you could code that. Of course, endocarditis is going to be what you're going to code here. You're not going to code this degenerative prolapse flail because endocarditis is more severe. We can go through that further if you have a question on that. We can go through that in the FAQ mailbox. We should code that as endocarditis, and then that flail is related to endocarditis. That's why you would code the endocarditis. It's not degenerative. It's related to something. So you're going to code that, and then you're going to code it as a class 2 because the way the leaflet is moving.
Yeah, I think the confusion is that for NYHA, the physician has to document the class, because I've been getting a lot of questions like this in the FAQ mailbox.
Yeah.
So if you can figure out the class by the documentation in the medical record, this is an area that you can do it with, as Carol was just describing.
Great.
Excellent. Yeah, great. Thanks, Melinda. Our next, our case type for the thoracic aortic procedures newly included in version 4.2, which have another additional portion of the data collection form for cases that have aortic procedures performed along with their cardiovascular surgery.
I can see the questions now. I can see that's the first one
Okay.
I can see. Our case types for
There you
the thoracic aortic procedure newly included in version 4.2, which has another additional portion of the data collection form for cases that have the aortic procedure performed along with the cardiovascular surgery. I'm not sure what that means. It's not, we didn't make a new section. We just duplicated the aortic valve section into the aorta section for those combined procedures. But there are no case types at this time for any of the aortic procedures because we don't have any risk models for them. So as soon as we have risk models for the aorta procedures, then they will have a case type. Melinda, am I missing anything, or did I totally misunderstand that?
No, I don't quite understand the question myself, Jennifer. Apologize for that. But you can send me a question in the FAQ if Carol did not answer your question.
Thank you. Oh, we have 3 questions left. Is that right? Is that right?
That's what I see.
Okay. I wasn't clear on the ability to make our data right if the patient ID duplication was an issue and did not get resolved. I did hear that indeed one of the cases was not available if we got that error. Beth, I'm not sure what that is referring to, but if you have a ticket ID number or something like that that we can pass along to IQVIA to check into, be happy to do that. I'm sorry, I'm not able to answer that question.
Yeah, I think that was the one that Jeanette was clarifying on earlier. So if we need to pass along to her, she could provide further clarification.
Okay, great, thank you. Next question, it says, why is not documented even a choice then under the valve regurgitation? So really, usually what happens for things like this, if the surgeon never documented it, the patient doesn't have it. So it's usually charting by exception. But again, you should really be checking out for echoes and for your cath reports, your TEE reports, to make sure that this isn't documented anywhere.
Well, and the other thing, just to add in, because this is my AQO presentation, it's part of it. Sometimes you'll have aortic valve regurgitation documented. The surgeon says he has regurgitation of the aortic valve, but you don't know the severity of it. Okay, so the child field is the severity of the parent. So if you don't know the severity, you know the patient has it, but you don't know the severity, then you put not documented because you don't know the severity of regurgitation.
Yeah, good point, Melinda, thanks. I thought we could use the peri-op TEE for val values if we have no other resources. Yes, that's correct. If you have a peri-op TEE value, you have no other resources prior to that, then you can use the intra-op TEE, pre-procedure. Pre-incision, I mean. When will we get the login info for AQO? I'm not sure, but it should be coming soon. I'm not sure exactly when they're sending it out. But I know that they're going to open up the recorded sessions about a week ahead of time, so you should have it by that time. I think we got through all of them. I'm sorry we went over so much. Heidi gave us a gold star. Thanks, Heidi. Uh-oh. Leanne put another question in. One of the previous webinars, it was stated multiple times that we are not to decide which class for Carpentier that the surgeons had to document. I don't know that we said that.
No, that was NYHA class.
Yeah.
NYHA class, which is sequence 915.
Yeah, there were several surveys given to make sure that we understood that now today it sounds like we can determine the class ourselves. No, we never said that you had to have surgeon documentation. It's really nice to have surgeon documentation to make sure you're capturing it correctly, but we were talking about the NYHA classification. For Carpentier classification, you can have, we went through this about how you need to look at your documentation. They're probably going to chart one or both of these. More than likely, they're going to chart the anatomical disruption or they're going to they're going to chart the disease process that's related, and then you're going to have to choose which class that belongs to. So like we said, we have, congenital is listed a couple times here. So you have class 3A, which is restricted. And then we have a mixed lesion, which is type 2 and type 3A. So you just have to, if there's confusion here, you have to clarify with your surgeons which class it is. But if you're able to determine that from documentation, you should do that. Okay, let's see.
I think you're done.
Thank you, everybody. All right, sorry for going over, but I hope you have a great rest of the day. Thanks so much, Leanne, Melanie, Jeanette, Jean, everybody who stayed on. Melinda, thank you.
All right, bye.
Great job.
Bye, take care.
Thanks, everybody.
Thanks, everybody.
Bye.
Bye.